Think your VA benefits replace Medicare? Think again. One wrong assumption could leave you with unexpected bills, limited access to care, or penalties that cost you money for years. Too many veterans believe VA benefits, Medicare, and Medicare Advantage all work the same way. They don't. Welcome to Insurance Therapy with Sasha. Today, we're breaking down the biggest mistakes veterans make and how to avoid them. Send this to a veteran you may know. Also like, share, and follow for more tips. This episode is for educational purposes only. Always consult Medicare, the VA, and a licensed professional about your specific situation. Let's get straight to it. VA healthcare and Medicare are two completely different systems. VA healthcare comes through the Department of Veterans Affairs. Medicare is federal health insurance. Medicare Advantage is a private insurance plan that provides Medicare benefits. Here's what many veterans don't realize. Having VA benefits does not automatically give you Medicare. Having Medicare Advantage does not take away your VA benefits. Knowing the difference can save you money and headaches. Case study number 1. Mr. Robert. Mr. Robert, age 68, used VA healthcare for years. When he turned 65, he skipped Medicare Part B because he thought VA coverage was enough. Later, he needed a specialist outside the VA system. That's when he discovered VA benefits and Medicare are not the same. Because he delayed Part B, he may also face a late enrollment penalty. The lesson: don't assume VA benefits replace Medicare Part B. Ask yourself, what if I need care outside the VA? What if I move? What if I want more doctor options? Could I face a penalty later? Having both VA benefits and Medicare may give you more flexibility. Case study number 2, Mr. James. Mr. James, age 72, enrolled in a Medicare Advantage plan after seeing ads promoting dental, vision, and extra benefits. Sounds great, right? But he didn't review the details. Later, he found out his preferred specialist wasn't in the network. Certain services required approval. He had questions about prescriptions and coverage. The lesson: don't choose a Medicare Advantage plan based on commercials or advertisements. Ask, are my doctors in the network? Can I still use my VA providers? What are my copays? What are my out-of-pocket costs? Do I need referrals or prior authorization? Always understand the plan before enrolling. Prescription coverage. Many veterans get prescriptions through the VA. VA prescription coverage is generally considered creditable coverage for Medicare Part D. That may help you avoid Part D late enrollment penalties. But ask yourself, do I get all my medications through the VA? Do outside doctors prescribe medications for me? Do I want access to local pharmacies? Your situation determines what coverage makes sense. For families, many families hear VA benefits and assume everything is covered. Then a medical emergency happens. Suddenly they're asking, is this covered by the VA? Is Medicare paying? Why did we get a bill? Which doctor can we use? Don't wait for a crisis. Learn how your benefits work before you need them. Here's a simple way to remember it. VA pays for VA-authorized care. Medicare pays for Medicare-covered care. Medicare Advantage follows the plan's rules. Knowing which system you're using matters. 3 common mistakes. Mistake number 1, skipping Medicare Part B because you have VA benefits. Understand the risks before delaying enrollment. Mistake number 2, choosing a Medicare Advantage plan without checking doctors, hospitals, and prescriptions. Always verify coverage first. Mistake number 3, assuming every veteran needs the same plan. There is no one-size-fits-all solution. Your health, medications, providers, location, and budget all matter. 2 smart strategies. Strategy number 1, create a benefits map. Write down VA doctors, non-VA doctors, prescriptions, Medicare coverage, monthly costs, travel plans, emergency contacts. This gives you and your family a clear picture of your coverage. Strategy number 2, get expert guidance before making changes. Before you delay Part B, join a Medicare Advantage plan, change prescription coverage. Talk to Medicare, the VA, a licensed insurance professional, SHIP counselors, veteran service officers. Bring information about your doctors, medications, travel habits, and health needs. Final takeaway. VA, benefits, Medicare, and Medicare Advantage can all be valuable, but they are not the same, and one does not automatically replace the other. Before making any decision, review your coverage, understand possible penalties, check your doctors, review your prescriptions, learn how VA and Medicare work together. A little planning today can help protect your health, your finances, and your peace of mind tomorrow. This episode is for educational purposes only. Always speak with Medicare, the VA, a licensed insurance professional, tax professional, legal professional, or benefits counselor regarding your specific situation. This is Insurance Therapy with Sasha. Real conversations, bold truths, empowering you to know the difference.